Hi everybody, this is Jennifer Langsdale again. I am back from Awaken Yoga School and I'm here to present you a short introduction to prenatal and postnatal aromatherapy, and this is through the American College of Healthcare Sciences graduate program for aromatherapy sciences. So I'd like to introduce this topic to you. It's something I'm really passionate about, something that's really close and dear to my heart, something that I've used in my paths of pregnancy to the stages of motherhood, and being a mother of 2 toddlers is something that I still implement in the daily lives and living wellness protocol of our family and our home life. But there is a lot of scientific evidence that through this graduate study program that I've already approached through my previous course, our research 501 class, I geared my entire research paper to the topic of prenatal and postnatal aromatherapy. So this is a sort of short, concise presentation that accumulated some of that information and some new research that we've done through the course of this training. So I hope you enjoy it. If you have any questions, please feel free to post that in my comment section, and I'd be happy to research that for you, because this topic is really exciting to me and something that I use in my career as well as my home life. So we'll start with basically what we know about prenatal and postnatal aromatherapy. So one thing that I learned through my research is that the research that's been done for the aromatherapy aspect of pregnancy is that there hasn't been enough formal research studies done, and most of the research that has been done has been with small groups in the clinical study field. So we do need a bit more research being done, and we also need the repetition of certain studies being done to really prove that aromatherapy can benefit the aspects of pregnancy that I'm about to talk to you about. The studies, being small that they are, indicate small control groups, so we know with any research program that we look for more people to get more results to share in order to support the idea of the research being really structured and proven true. So the research that has been done, and throughout my course of study in my previous semester, really showed that the research that has been done supports the fact that aromatherapy really does work in the facet of prenatal and postnatal healing arts. Childbirth benefits from aromatherapy are factual, that the women in these small test groups or the practitioners using aromatherapy in these test groups have proven that aromatherapy is something that is aiding in the stress management of pregnancy, labor, and postnatal care. So one thing we know as a fact of how aromatherapy works is that smell is connected to a direct pathway to the brain, and we know that smells can be calming and soothing and have an immense effect on how we feel. So of course, through our stages of pre-motherhood, through the end result of having our children, is that we know that aromatherapy is going to work in some degree to benefit mother and baby on those levels of calming and soothing and bringing down stress levels after just having a baby. One thing that our clinical aromatherapy book indicates is that hospitals do not smell good and usually don't have a beneficial scent memory for most people. So we understand that aromatherapy in general helps people manage their stress levels in a hospital setting. So of course we could bring that into the delivery room as well. So with a quick intro to prenatal aromatherapy, we know right off the bat that the major symptoms of pregnancy and going into the delivery room are going to be things like nausea, pain, anxiety connected to pain. Even pain during pregnancy can make you pretty anxious, especially when it's on a daily level. I definitely incurred a lot of that in my third trimesters of both of my children. There's the fear factor, especially for new mothers. They don't know what to expect when they're going into the labor room for the first time, or maybe they're a few weeks out from their delivery date. There's also the indication of, things going wrong in any trimester when you're having a baby. We also incur lots of trouble sleeping. Usually multiple trips to the bathroom can disrupt your sleep patterns. Pain, discomfort, the fact that you have to lay on your left side. When you sleep at night, you can't sleep on your back or your stomach anymore if you're used to that. Can definitely incur disrupted sleep patterns, and then even blood pressure imbalance. So these are some common things that most people endure throughout pregnancy, or at least in the later stages of pregnancy or the beginning stages. So there's a list of essential oils. I'm not going to review it now because I'll review it later on, but I just wanted to have that slide there for you to visit first. And you can pull from this list as your sort of safe to use list. So a couple of factual things I wanted to pull into this, a couple of the articles that I pulled for this topic, is some special things that we can note that the oils do according to their chemotypes and their constituents. So we know peppermint reduces cortisol levels, which is a hormone that's released when you're stressed. So definitely introducing that into some kind of a mist or a spray in the bedroom, in the delivery room, at any time during your pregnancy would probably be good. And we know peppermint's really good for nausea, and that's something that a lot of mothers endure through the changes of their hormonal levels. We also know that peppermint increases the good stress levels in the body. So in the labor room, I can tell you the amount of fatigue and the amount of pain that you're enduring during natural childbirth, which I did birth both of my babies naturally. They were 10 and 11 pounds. So I can vouch that aromatherapy really helped in those stages of pushing a baby out. But they can help you hit that sort of goal-oriented stress that you do need to know that there's a sense of urgency that this phase of labor really needs to happen. That active labor is good. We know that we're hitting our goal of having the baby, and we're trying to hit as least amount of roadblocks as possible. Clary sage has been used during labor to increase uterine contraction. So the whole idea behind a contraction is that to not be afraid of the contraction, to not be afraid of the pain of the contraction, but to go through the pain and understand that each contraction is one step closer to having a baby. So when your contractions might stop, that can be very frustrating and very stressful on a mother. So maybe clary sage could be something that a mother could use when labor's kind of stalling out to revamp things up. I am not quite sure. I'm educated enough to talk about how we would apply that kind of oil in that instance, but I'm thinking that a massage oil through the skin would probably be the way to go if we're trying to get the oil into the bloodstream. You could probably diffuse it into the air, but I'm not quite sure on the absorption level how much that would help if we were trying to bring on stalled contractions. Eucalyptus and thyme, in general, one thing that I read a lot through this research was that, of course, if you're going to be in the hospital setting, you are going to be at risk for certain viruses and things going around in the hospital. And of course, your immune system is very vulnerable at the time you have a baby. Your body's under immense stress. So one of the best things you could do is maybe run a diffuser in the room with something that would be considered antiviral, antimicrobial, something antibacterial. So just for example, eucalyptus and thyme maybe. And these are very uplifting scents. And when you're tired, especially if labor is long, then maybe an uplifting scent might be something that you need. So contraindications, when you're pregnant, you're not fragile, but at the beginning of your pregnancy, there is a certain sort of fragileness to that, as the fetus is doing a lot of work at that time to grow and to develop properly, and your body is also going through the same thing as it builds the home inside you for the baby. So contraindications for using oils are going to remain the same throughout pregnancy, but really in the first trimester, the research shows that we should refrain from using any amount of essential oil, just because we do know that the oils get absorbed through the skin. They are going to get absorbed through the uterine lining. We're not quite sure we have the right amount of research to show yet what that entails and what's going to happen to the baby. So err on the side of caution. Definitely urge mothers maybe not to use any essential oils on the skin. If anything, maybe a light diffusion in the air would be safe, or some kind of a mist. But the direct sensitization of using oils on the skin or in the bathtub even would probably be best to be saved for the second and third trimesters. So at this point, if we're in the second and third trimester and we're going to start to use some aromatherapy on the skin, we would want to avoid any high concentrations. So we're going to use the most minimal amount of oil possible, recommended dosage for what it is you're trying to do. So one thing that was suggested in one of the texts that I provide reference to is to use an herbal remedy instead. You know, if you're a little nervous about using an essential oil, you're just not quite sure you're educated enough on the topic for yourself or for your clients, then just use an herbal remedy instead and use that lower dosage amount. The knowledge of the constituents in each oil is definitely going to be helpful. For example, Smith suggests using clary sage and fennel only in labor, as they may increase uterine contractions, but to fully avoid it in pregnancy. And you're going to see this a lot when you're researching about essential oils, to not use a lot of the oils in pregnancy due to their chemical constituents. Another example of that might be to not use nutmeg and cinnamon, as it is a pain reliever. It can also stimulate the cardiovascular effect and should be avoided. So we definitely don't want our blood pressure to be any higher. We're in pregnancy. A lot of women already have high blood pressure in pregnancy in general, and sometimes low blood pressure, but we're trying to avoid stimulating that in any negative way. So again, a little bit more safety tips. So we're not going to use our oils in the first trimester. We're going to avoid using the same oil over and over again. And this is for everybody, not just in pregnancy, but I guess you could say especially in pregnancy. We want to avoid that, using that same oil over and over again, and breaking up how we're using the oils, and of course keeping that low dosage amount. We want to avoid being in the sun, especially with the citrus family of oils, because that photosensitization. So same rules apply in general of what you're using for your clients or yourself, carry over into pregnancy, but definitely overtly err on the side of caution. It's probably best to only use one oil at a time in pregnancy. We don't understand quite how the body's going to react when you're pregnant. The things happening in your body all change, your hormones change, how your body's functioning can change. So it's probably best one oil at a time, using mandarin, using lavender, and using a specific oil geared to a specific effect, rather than working on any serious blending at this time. By far at this time, you're going to want to urge mothers, and of course yourself if you're working on a client who's pregnant, to only use the most purest, freshest, reputable oils out there, to avoid using any kind of lotions or mixtures that have a mix of things going on in them, and just stick to the purest product available. So if you are somebody who's really interested in working with pregnancy and mothers, we definitely urge that a fair amount of training has been done on the topic of aromatherapy in pregnancy, because again, we're working with chemicals, we're working with an undiluted product. We want to make sure that we understand to the best of our knowledge how we are presenting our care to our clients. So some recommended uses during pregnancy. One of the best things I can tell you I used to do as a pregnant mama with essential oils would have been to take a foot soak. I had immense swelling in my feet, and even in my ankles and up to sort of where my calves were, but the feet definitely suffered, especially in the warm and hot summer months. So taking a foot soak to just find some comfort and ease of stress and discomfort was an amazing thing. Of course, peppermint was high on my list for that refreshing feeling. You could use any of the oils that are listed safe, and again, just a couple of drops is needed into a large tub. A back massage is quite a wonderful thing when you're pregnant, especially as you gear up towards your heavier stages of pregnancy. Back massage can help to ease the pressure from weight gain, and when your baby is positioned in an awkward way, we definitely suggest massage as a way of easing discomfort. Aromatherapy, honestly, I can tell you from my own personal experience, heightens the pleasurable sensations of the massage, definitely helps to make you feel more relaxed, and has a little bit more of a lasting quality throughout the day that maybe you receive the massage. Hand massage is really nice. Again, fingers can swell. Some women endure carpal tunnel syndrome just during the time that they're pregnant, and once the baby is delivered, that all seems to go away. So again, just getting a nice massage on the hands with maybe a little bit of essential oil that agrees with the client. And then making a mist and maybe popping it into your purse or your handbag as an expecting mother for times where you feel nauseous or stressed or just need a little bit of upliftingness, especially for mothers who already have small children that they're caring for and are pregnant. So after baby, there's a plethora of things that essential oils can do. We do have to err on the side of caution still, because a lot of mothers are nursing, so we want to make sure that we're being careful of what we're putting into our bodies. And of course, if you endured anything through your birth, if you gave birth through cesarean or vaginally, a lot of things can happen with incisions and things, so we want to make sure that we're being careful with what we're putting into the bathtub or applying to our skin. So some suggestions are just in general, safety-wise, you're not real sure what to suggest to somebody. Safety-wise, we would suggest diffusing the oil into the air. We don't want to keep it too close to the baby. You've got to remember that baby is brand new, and as far as pounds goes, for the amount of weight that that baby weighs compared to us, they don't need really anything at that point. So if we're going to be diffusing, put your diffuser maybe in the room that you're nursing, but maybe on the other side of the room, and use the oils that are listed on the suggested safe list. And we're not going to diffuse 10 drops into the diffuser, maybe just 3 to 5 drops to err on the side of safety. And I think the general guideline has been about 6 weeks. We try to use as minimal items as possible around baby. So we can use a diffusion to create a sense of calmness, to combat depression, and it is definitely the preferred safest option in the postpartum era of having a baby. So when we are bathing as a new mother, some recommendations of oils were geranium, fennel, and clary sage, and it was recommended as a diuretic, but also hormonal balancer in the tub. So would we use the full dosage? Probably not if you're nursing, and you'd probably want to check with if you have any stitches or if you have anything going on in the pelvis that you would want to be aware of before taking any kind of a sitz bath or an aromatherapy bath. You definitely have tense muscles after you have a baby, and especially if you are nursing from holding baby, especially if it's your first time. So we would probably want to soak maybe with something a little bit more warming, like ginger. Lavender is always a nice, inviting, and soothing scent. Bergamot too, and fennel were all recommended. Breastfeeding mothers may want to proceed with lighter dosages of the oils, as I suggested through before, because the oils are absorbed through the skin. Safe oils that are uplifting and have emotional balance for women especially are recommended as neroli, jasmine, and rose into the tub. They're also really great for the skin, and just on a personal level, they're very goddessy. These are very flowery, elixir type essential oils. They're really gonna make a woman feel good about herself. If you have incisions or tears, they recommend in the tub the use of chamomile and lavender is there. They're nice anti-inflammatories. They're good for the skin, and they're very soothing as a compress as well. If you wanted to put a drop or two into a bowl of warm water and maybe apply it to the area that's causing pain. If you have the baby blues, they recommended the use of juniper and lavender. And those two are also very useful for fluid retention, so kind of a 2-in-1 deal. We want to make sure our infants are avoiding any direct contact with the oils until they're 6 weeks, but honestly, from the research that I've done, the oils that were suggested were mostly because of maybe some colic. Lavender came up as safe. I've even read before, but I didn't post it in here. I wasn't super excited about the research that had been done on it, but fennel has been suggested in a lot of aromatherapy books for colic. And one thing you could do is just put a drop into 1 ounce of a carrier and maybe massage your baby's belly or backside with that. Or you could, if you were afraid to use the oils, buy an herbal sitz bath and let your baby absorb the oil, or absorb the herbs through the skin, just like we would essential oils. With my children, lavenders did seem okay, and I did try the fennel when I had a colicky baby once. It didn't seem to hurt my child at all. It was highly diluted, but now that I'm researching and knowing more about the oils, I would say I would err on the side of caution, and I would use the herbs over the oils until baby's a little bit older. The perineal healing is a big deal after baby, so you could make a nice mixture of oils using lavender, chamomile, or immortelle. So there's a nice blend that you could put together there. I'd say probably more heavier on the lavender than the other two, just because it just seems to be the safest of all the oils being suggested for this time in a mother's life. For the labor piece of what to do in this stage of a mother's life, we know there's a lot of studies that have supported using aromatherapy in labor. I did tell you the studies are rather small and definitely on the non-repetitious side, so there's a lot of opportunity for more research to be done on this. But the studies that have been done do support that aromatherapy for laboring mothers is helping them with things like nausea, helping them to manage their pain better, strengthen contractions, and decrease vomiting. There's also studies that show that the outcome of labor measures decreases the need for additional pain relief. I can tell you from my own personal experience through having both children that aromatherapy was present, Freudian slip, present in both of my children's deliveries, and I found to be very, very helpful, and very helpful in the realm of concentration and focusing, especially when it came to the point where we were going to be pushing. Hand and lower back massages can be very helpful in the labor room as a doula. I know this really helps my clients when I was taking clients. So, and just a generalized massage with an unscented carrier oil is beneficial, but then applying maybe a little bit of lavender or peppermint to the skin if mother is okay with those smells. We have to really make sure we clarify it with her. We have to be cautious about our mothers, expecting mother scent preferences. Things can make you feel really nauseous when you're in labor, so even aromatherapy could have an adverse effect, so we definitely want to make sure that we ask mother if it's okay and if it's something that they like. And to make sure we're not adding any oils in the tub if you're laboring in the tub, or if you're going to have a water birth, which I did have, and you definitely don't want to put anything in the water when you're expecting to push the baby out in the water. Oil suggestions during labor are clary sage. They strengthen contractions. Roman chamomile initiates contractions, but also guides in relaxation. Lavender is everything for everything. All the things that listed here, lavender seems to help aid in. Peppermint for nausea, or again for maybe a refreshing foot bath in the beginning, early stages of labor when you're kind of bored but contractions are just starting to come on. Mandarin is wonderful for calm, but also for grief. Grief's a big part of having a baby. Sometimes things don't go the way you planned. Maybe you planned a natural childbirth and you had cesarean instead. Maybe your birth plan wasn't honored. Maybe things didn't go your way. And then maybe things didn't end up the way that, of course, we would want them to. So there has been some studies done on Mandarin and Rose for the stages of grief in labor, if you're interested in learning more about that. So there's some references for you if anybody's interested in reading the research paper I compiled last semester. I am happy to send that in an attachment as well. If you have any questions, please feel free to contact me or put something in my comments section, and I'd be happy to hear from you. I'd love to hear your comments. Make it a great day. Namaste.